In this video, let's talk about CAPD, or Central Auditory Processing Disorder. My name is Josephine. I'm the Webinar Research and Development Specialist at Here Center, and we're really excited that you clicked on this video. Here we'll talk about what CAPD is. I can tell you right now that it's a disorder that involves difficulties in processing auditory information and that it affects around 3 to 5% of school-aged children. We'll discuss the symptoms of CAPD, which can range from mild to severe depending on the case. Later, we'll discuss how it's diagnosed and certain things to keep in mind before scheduling a CAPD evaluation. Finally, we'll discuss evidence-based methods and strategies that help manage CAPD. So let's jump right into it. So let's talk a little bit about what CAPD is and what's happening with our brains with this particular disorder. A concept you'll need to be aware of is something called central auditory processing. So according to the American Speech, Language, and Hearing Association, central auditory processing refers to how well our central nervous system understands what our ears hear. So in other words, it's what our brains do with the auditory info it receives. When an individual has CAPD, it is difficult to process the auditory information, especially in unfavorable listening environments. To put it simply, CAPD refers to an ear-brain disconnect. Individuals with CAPD have trouble registering what is heard, trouble remembering what is said, and they are weak in decoding and understanding skills that are supposed to develop naturally as children grow up. With CAPD, children and also adults are listening but not taking in the information. That there is the issue with the processing. It can be especially tough when the environments are very busy or not ideal to hear others well. Those with CAPD can also have issues with communication or learning because they simply cannot understand what is said to them. This can look like poor performance in school, not being very attentive, or just trouble with learning in general. But we want to make a note here. Having CAPD does not mean someone has a hearing loss or a learning disability. Yes, there may be some overlap in symptoms with other learning and attention disorders, but for the most part, someone with CAPD will not be put in a special ed classroom or be labeled as having a learning disability. In general, there are 4 areas that those with CAPD struggle with: auditory discrimination, auditory figure-ground discrimination, auditory memory, and auditory sequencing. Auditory discrimination refers to someone's ability to notice the difference between sounds. It's being able to tell the difference between pat, cat, and that. Auditory figure-ground discrimination refers to someone's ability to focus on speech or sounds in noisy settings. This could be listening to 2 people have a conversation or listening when you're in a loud, crowded environment with lots of background noise. Auditory memory is how well you're able to recall what someone has just told you, either immediately or about something that's happening in the future. Can you recall what you just heard? And auditory sequencing is understanding and recalling the order of sounds and words. It's being able to recognize a specific sound that appears at the beginning of the word, end of the word, and how different words and different sounds create words with different meaning. Unfortunately, researchers and scientists have still been unable to determine the exact cause of CAPD. While there have been links to head trauma, lead poisoning, and chronic ear infections as possible risk factors for developing CAPD, the research is still unclear. And for parents or anyone who has CAPD, this can be really frustrating. And we get it. We want to know why this happens just as much as you do. But what are some things to look out for if you think your child or someone you know has CAPD? What does CAPD look like? Well, CAPD often appears in childhood, but adults can have it too. It can show up in people of all ages and in different ways. CAPD is also often misunderstood because, as I mentioned briefly earlier, its symptoms overlap with other learning and attention disorders. For example, ADHD and CAPD have similar symptoms with inattention, poor listening skills, and so on, and they're often misdiagnosed for each other. Sometimes someone can have both conditions, which makes it even more complicated. But if you're just starting to look into CAPD and you're not quite sure what you should be paying attention to, there are some questions that you can ask. So if you're a parent, or maybe if you're just trying to see if you have CAPD yourself, here's some questions you can ask. So if you're a parent, does my child often mishear sounds and words? Do they get overwhelmed in noisy environments when they're trying to listen? Do they hear and respond better in quiet environments? Do they have trouble following verbal directions, whether simplified or complicated? Do they also struggle with verbal word math problems? And do they seem to struggle to follow conversations? Here are some of the consistent symptoms that show up, and as you'll see, they're very similar to the questions we just went over. So someone with CAPD may struggle with directions. Any verbal directions, especially those with multiple steps, can be difficult for someone to follow with CAPD. The person may also ask you to repeat what you said frequently. Maybe they say, huh, or what, a lot. You notice that this person has trouble following conversations, especially when there are multiple speakers involved or if you're in an environment with some background noise. Similarly, this person is also easily distracted when there's a lot of stimulation or background noises going on. Do you notice them forgetting things that you've told them? Either things you've said to them or stuff they've read. Someone with CAPD may look like they have issues with their memory. And lastly, you may also notice that this person is quite slow in conversations. If they have CAPD, this is a sign of them needing more time to process and make sense of what is being said to them. So after those last two slides, you might think that your child or someone you know might possibly have CAPD. What do you do next? Well, we will quickly mention that CAPD is controversial depending on who you speak to because some experts don't agree that it's a disorder. There are also multiple definitions that exist to describe CAPD and its symptoms. But we at Here Center do acknowledge it as a disorder and have guidelines for evaluating an individual for CAPD. For the most part, these are the general necessary components in order to do an accurate evaluation for CAPD. So first, the individual must be at least 7 years old. This is because children's auditory skills are still being developed and we don't want to test them too early. We want the natural course of their hearing development to reveal itself before we make any CAPD calls. Second, if your child does have issues with listening or following directions, we need to rule out hearing loss as being the potential cause. An audiologist will need to perform this evaluation. And third, as we mentioned before, certain learning and attention disorders can be mistaken for CAPD. If there are any cognitive deficits with the child, if they have autism or untreated ADHD, then they may not be a good candidate for evaluation. Before you get evaluated for CAPD, we first recommend that your child get a psychoeducational evaluation first to rule out ADHD. If a child is currently being treated with medication for ADHD, then it may be possible for them to have the CAPD evaluation. So, after we get the go-ahead with the hearing test and other evaluations for learning and attention disorders, then the audiologist can begin to do the full battery of testing for CAPD. In general, these are the 5 areas that an audiologist will look at. I'm just going to briefly touch on each one of these, and as you'll see, it does overlap some of the symptoms and issues of CAPD that we talked about earlier, which makes sense. Audiologists are trying to see how well an individual can succeed in each of these areas. So when audiologists look at auditory figure ground, they want to see if the individual is having difficulty with understanding speech when other speech or ambient noise is in the environment. With auditory closure, they're testing for if a child has difficulty filling in the gaps of speech, for example, either during quiet situations or when the speaker is speaking too quickly. With auditory listening, audiologists are seeing if a child has difficulty understanding competing speech happening at the same time. So this could look like if a child is seated and there are 2 people on the other side of them having conversations. Can they follow it or can they pay attention? With temporal processing, they're examining timing issues with the child's auditory system as it takes in information. This helps them identify differences in speech sounds and recognize intonation. They'll also look at binaural interaction, which is the ability to tell which side a sound is coming from, as well as its location in the room. Electrophysiology testing, such as an MRI, may also be performed elsewhere as part of the evaluation. Another reason why we want to keep into consideration the child's age is that the battery of CAPD testing is around 90 minutes long. So this is something to consider if you are considering a CAPD evaluation for your child. And while there is no known cure for CAPD, there is a lot that can be done to improve listening skills, make the day-to-day easier on your child, and maybe even strengthen the weakened auditory pathways over time. If a diagnosis of CAPD is confirmed, the earlier you can begin treatment and adopt good management strategies, the better. Prolonged auditory processing issues can have a big impact on a child's learning and performance in general. So usually after testing with an audiologist, the results will be sent to the child's school and adopted into an IEP. So remember that having CAPD is not technically considered a learning disability, and kids with CAPD are usually not put into specialized education programs. But the Individualized Education Plan, or IEP, will detail all of the necessary supports that the child will need in order to succeed in school. That IEP may detail some classroom accommodations to optimize listening, or it may suggest therapy with the school's speech therapist. Parents also have the option to seek a private speech therapist who specializes in CAPD. Speech therapy is the main treatment because it helps children distinguish, remember, and know how to arrange sounds. So if you remember the common areas of difficulty with CAPD, the processing, identifying, and ordering sounds, speech therapy can help the brain make those connections that have been weakened or undeveloped. It can also help with language and overall communication skills if a child does struggle in those areas. Something to consider is that the auditory system isn't fully developed until kids are about 14 years old, so there is a possibility that children diagnosed with CAPD can develop those better listening skills as they grow up. Their auditory system will mature with them. So in those situations, although not guaranteed, it's possible that CAPD would appear more as a delay in their development rather than a deficit. But rather than waiting to see if that is the case with your child, we definitely recommend some home and school strategies that you can use to support your child now. So at home, you can try some of these strategies to help a child who struggles with processing auditory information. Whenever possible, reduce the background noise that's around your child when they're trying to listen and focus with intention. This eliminates distraction and allows them to zero in and focus on what's being said. Face your child when speaking with them. This helps them focus more on what you're saying and gives them visual cues to fill in the gaps of missing information. Chunking verbal directions means giving your child simplified directions with less words, a single keyword to remember in that set of directions, and fewer steps. This can help break down an otherwise complex task or set of directions for them. And speaking louder doesn't always help someone understand you better. A good key or a good point to always follow is to speak slowly and clearly when you're trying to have someone understand you better. This gives your child or the person the best chance of them understanding what you're trying to say. You can also ask your child to repeat information or directions back to you so you can see if they understood what was said. Some schools have special programs for those with CAPD, so ask the administration if that's available. I'm not sure how it would be or is being adjusted for virtual learning, but I'm sure you could always ask them and find out. Now, before the pandemic, a common strategy to help children with CAPD at school is to use something called preferential seating. This may be strategic seating so that the child is closest to the speaker or the teacher, but it can also include things like having the child sit away from the window or a pencil sharpener that can often bring a lot of background noise. The key with this seating is to optimize your child's hearing for clarity and understanding in the classroom. With virtual learning, some things teachers can do is to pre-teach children with CAPD new words and concepts ahead of time. Remember, children with CAPD process information a bit slower, or process auditory information a bit slower. So preparing them with pre-teaching would help them a lot. During the virtual lectures, emphasizing keywords and using visual aids could also help children understand those main points without the extra distractions. Getting to the point helps them process the material better. You might also want to see if classes or lectures can be recorded so that the child can easily pause and rewind the points that they miss or have trouble understanding. There are some computer-assisted programs that exist for children with CAPD, and if you do a search on the internet, I'm sure you could find a few that are relevant for your child and what they're currently learning in school. Another option to consider to help manage the effects of CAPD is something called educational therapy. Now, this is not tutoring, but it still has the one-on-one aspect. The educational therapist would use a broad approach to help build academic skills and confidence in your child, and they can help with almost any learning or thinking difference. So with an educational therapist, your child could learn strategies to compensate for the skills deficits, learn to manage frustrations that come with the CAPD struggles, and remember to play to their strengths. This is just something else to consider in your treatment and management plan for CAPD. Okay, so that takes us to the end of this video, the presentation. We know there was a lot of information that we covered, but we hope that you have some more clarity about CAPD and are thinking about some next steps that you would want to take. So to remember, CAPD is not a learning disability or evidence of hearing loss. CAPD is an ear-brain disconnect. Someone with CAPD has trouble understanding the information or sounds that they hear. If you're thinking about scheduling an appointment for CAPD, or an evaluation for CAPD, remember that your child has to be 7 years or older, has no hearing loss, and does not have an undiagnosed learning or attention disorder. An audiologist will determine if your child has CAPD through various testing that could last about 90 minutes in total. As there is no cure for CAPD, treatment and strategies is how we manage the CAPD symptoms. On the service-based end, you have speech therapy and educational therapy, to name a few, and then you also have the practical strategies such as adjusting your communication style and the environment around your child. Children or individuals with CAPD can lead successful lives. Early diagnosis coupled with good management strategies can help make strides in their education, life, and well-being. Okay, so thank you so much for sticking with us to the end of the video. If you have any questions about CAPD, please feel free to send us an email at info@hearcenter.org or give us a call at our number below. Thank you, and we hope to see you in the next video. Have a great day.